Is it important to have a protocol on how to handle people that have had concussion? And how do you know to tell the patient how they can recover?
Sure. I think it's imperative that you have a protocol with which you follow to make sure that person returns to play safely.
What do we do if an athlete wants to go back in the game? You think he has a concussion, you keep him out of the game. What do you do as far as deciding how to return to the game that day or next week or 8 weeks?
Sure. Well, certainly, like we mentioned before, if you have a concussion on the day of game, you should never return to play. Even if you're not sure, you're considering that as a possibility, you should err on the side of caution and not return to play, because the risk of recurrent injuries, particularly on the day of an injury, is very high.
So a stitch in time saves 9, meaning if you're even questioned, you just say, sorry, you can't go back in, you take the helmet away, and then what do you do? Because he's heartbroken.
Yeah. And it's one of those things that it's sometimes hard to explain to the student athlete and the coaching staff as well. But I think the recognition of concussions and the importance that we placed on it, I think people are beginning to understand that and are more accepting of being a little conservative, being a little cautious in making sure that you protect your athletes.
So let's talk about the next 24 hours or the next 48 hours. What are you looking for?
Yeah, we keep a close eye on them over the first several hours after the injury, just to make sure that their symptoms don't progress, worsen, or become more severe. Certainly, if any of those things happen, then we often do a more urgent evaluation, perhaps at the hospital or emergency room. Most people don't have that problem. Most people do quite well, and then we monitor their symptoms in a progressive fashion. The first step is really to allow their symptoms to resolve at rest.
At rest?
Correct.
What do you mean by rest? In the bed?
Well, not necessarily in the bed. No, we allow them to go to school. We allow them to be active. We don't allow them to do heavy workouts. Certainly don't allow them to practice or play their sport. We allow them to just be a normal individual.
If you rest the brain, does that mean you can't watch television, you can't play Xbox or the other games and this and that?
Certainly. That certainly can contribute to your symptoms. Any sort of visual stimuli that produces your symptoms or aggravates your symptoms, makes your headaches worse, your dizziness worse, we ask them not to do that. Not only does it make them feel bad, but it's also delaying their recovery. Again, anything that exacerbates symptoms, we want to minimize or restrict. And that may include even going to school. You know, I've held student athletes out of school just because trying to concentrate and listen to the lectures can be provoking of their symptoms. So a short period of rest from school may even be indicated.
At a younger age, let's say a child who's 11 years of age and they are knocked unconscious and they come out and they're fine and they've got a little headache the next day. At a real young age, is it a time to say, let's wait till next year, or is it okay to follow them under a protocol of rest?
I think that you can follow them under a protocol of rest. I don't think you have to keep that individual out for the rest of the year. Although I am very cautious or careful with the younger age kids, only because they still have developing brains and they are sometimes at a higher risk or have more prolonged recovery than someone who is a professional athlete or a college athlete who's 20 or 22 years old.
So back to the college athlete. You've had him rest, you've had him stay away from brain stimulation. Then what do you do?
Once they feel like their symptoms have resolved or they're feeling really good and back to normal, then we do an exertional progression. So we have a very outlined protocol in terms of having them do some biking, some sprinting, some running back and forth, and maybe even some sport-specific drills. For example, a receiver may run pass routes and catch a ball. We're monitoring them every step of the way to make sure that activity doesn't reintroduce or reprovoke their symptoms.
So what are you looking for? What kind of symptoms, if you're on that recovery stage, just running down the field, catching a ball without any contact or anything?
Yeah,
what are you looking for?
Well, we're observing them in terms of, are they missing passes? Are they not remembering the pass route that they were given? You know, are they having trouble recognizing the things that they need to do? And then again, as we mentioned before, it's very subjective, so we'll stop the athlete after the activity and say, how did that make you feel? What did you sense? How does your head feel? How does your sensation feel, your vision? Those sort of cues.
Do you have any written tests that you take before the season that you can compare thinking ability
Sure.
later on?
Absolutely. We call those cognitive evaluations. And before the season starts, we do two cognitive evaluations. One is sort of a quick paper and pencil type of test that we ask the students to fill out with us. We walk them through that. So we have a day of injury cognitive evaluation. So we know kind of what they're thinking and how they're processing information. Then we have a more detailed computerized version of that test that asks for memory, visual memory, verbal memory, reaction time, speed of answering questions. That gives us a little more comprehensive view so that we can use that test prior to return to play to make sure cognitively they're back to baseline.
Do most people cognitively at a college level return fairly quickly or not? That's exciting. You're getting very sophisticated.
Yeah. Well, in my experience has been that most of our student athletes at the college level do recover relatively quickly. If you look at the averages based on the studies, an average return to play time is about 7 to 10 days. The younger student athletes and sometimes the female student athletes take a little bit longer to recover than some of the more seasoned athletes. Again, everybody's different, and certainly factors like prior concussion injuries may play a part in that, the mechanism of injury. But on average, I think most of our student athletes in the collegiate level do pretty well. They recover a little quicker than some of the younger athletes.
So when headaches are gone, confusion's gone, amnesia's gone, thinking is good, testing is good, they're feeling good, how do you gradually put them into contact?
Right. It's one of those things that each one of those things that you just outlined are little pieces of information that we collect and put together to make our final decision. In addition to the computerized testing that we talk about. Once we feel like that individual is back to a baseline, back to where we feel good about their status, then we usually introduce a non-contact practice. So we have them kind of do a little bit of bumping of pads and that sort of, not allowing people to tackle them or hit them, but bumping of pads and monitoring their activities that way. If they do well with that, then we allow them to return to contact. So it's, again, a stepwise progression, and each piece of information each day is important in making those decisions.